Hello, I'm Dr. Simoni, and I'd like to inform you about an important condition that could potentially cause cancer. That condition is called GERD, or gastroesophageal reflux disease. Some may know it as heartburn, regurgitation, or simply reflux. The trouble is that most people who have GERD do not know that they have it. The reason is that GERD can manifest itself in many different ways, such as cough, throat clearing, hoarseness of the voice, sinusitis, postnasal drip, and even chest pain if it's not cardiac related. Medications have been the mainstay of treatment for GERD for many years, but drugs either cancel out the acid or stop acid production, but they don't fix the valve. The stomach acid is actually needed for many different functions aside from food digestion. As you might imagine, getting rid of acid may only put a band-aid on the problem. Fortunately though, in 2005, a device called Esophax was developed in Europe to help fix the root of the problem. So this is called Transoral Incisionless Fundoplication, which is a non-invasive procedure. The device was approved in the United States by the FDA in 2007 and was one of the first gastroenterologists in the country to have the privilege of using it. TIF is a 40-minute procedure without making any kind of cuts on the body. The loose valve often happens in conjunction with the hiatal hernia that can be fixed with TIF. If hiatal hernia gets too large, then the TIF has to be done in conjunction with a surgical procedure called hiatal hernia repair. If you have been suffering from GERD or any of its manifestations, or you have been on medications for treatment of GERD, you may be a candidate for TIF. Before we can schedule you for a TIF, we have to evaluate your valve. That is achieved by performing an EGD or esophagogastroduodenoscopy, or simply an upper GI endoscopy. Here's what you have to know before the TIF procedure. All right, so it looks like you've decided to go ahead with that surgery, with TIF. So there's a few things that you have to do. Somewhere before 2 weeks of the procedure, you have to have a pre-op evaluation by your primary care physician. They're going to do some blood tests, they might do a chest x-ray, EKG, to make sure that you're a candidate for surgery. All right? 2 weeks before the surgery, I'm going to have you start taking some antacid medication twice a day. All right? You're going to be either on Prilosec, Protonix, Nexium, Prevacid, anything that your insurance company would allow us to do for about 2 weeks before the procedure. About 10 days before, I want you to stop taking any kind of herbal supplements that contains any ginkgo, garlic, or St. John's wort. All right? About 5 days before, I want you to stop taking any aspirin products, any kind of blood thinners, as long as it's okay with your primary care physician or your cardiologist. I want you to stop taking any fish oil. And then we're going to give you a list of things to buy. Some of these are going to be prescription medications that you're going to pick up. These are for post-op. And some of it is going to be diet. We're going to have you buy some protein shakes. You're going to have it ready at home because you're going to be on liquid diet for about a week after the procedure. But make sure you don't buy anything that's tomato-based. You're going to have some gelatin, pureed vegetables, pudding, things like that, so you can have it ready after surgery when you get home. You don't have to go shopping. Okay. All right? And then 2 days before surgery, we're going to give you a contact number that you're going to call to make sure that everything is set. And the day before surgery, your supper is going to be a very light meal. And if your surgery is early in the morning, you're not going to have anything to eat or drink after midnight. If it's in the afternoon, you can have clear liquids up until about 3 or 4 hours before surgery. Okay? And then I'll see you then. Great to see you. All right.
Thank you.